We're on the road headed for a remote village in South Sudan's Upper Nile region. This is an area that's seen plenty of fighting. We pass a destroyed armoured personnel carrier, the remnants of a past battle. This is territory controlled by opposition forces. We travel in convoy and fast until we reach the hospital in the village of Kodok.
So here we have the one of the male wards in here.
We've come here to meet Andrew Cameron, a nurse for the Red Cross. From Hawke's Bay, he's worked in conflict zones all around the world, including Iraq, Yemen, Afghanistan, and now South Sudan.
This gentleman, was shot in the leg. It was quite a difficult operation to save his foot.
In just the 5 months he's been here, he's helped around 100 gunshot victims.
This one night we received about 15 men who had been shot.
Were these civilians?
Yes, that's right, yeah.
In some cases, the war wounded don't make it to the hospital quick enough. There are plenty of guns here, but not much in the way of transport or fuel. Andrew recalls one patient he attended to recently.
He received a gunshot wound in the leg, and it had been some days before he got here. The leg was becoming gangrenous, so the surgeon decided to take the leg off to save the man's life.
The hospital sits on the edge of the Nile, a key transport route for fighters. It's a hostile environment, even for health workers. What's happened here, Andrew?
A rocket came over from the other side of the river and hit the hospital. The team had to evacuate pretty smartly. And one hit the school over there. You can see a hole just above that window.
South Sudan was plunged into chaos in 2013, just 2 years after it gained independence. The president accused his deputy of an attempted coup. Inter-tribal fighting spread to the streets. Innocent civilians have suffered the most. Thousands have sheltered in UN-protected camps. Andrew says it's a conflict Kiwis should care about, irrespective of how far away it is.
These people are suffering and they are far less fortunate than ourselves. A lot of them just living day to day, often with limited food and limited security.
Survival here is often about teamwork. Dorothy Machkachika screens children for malnutrition.
The problem is quite big, Mike, because the prevalence of malnutrition is above emergency threshold.
Displacement because of fighting means in many cases families are forced to eat whatever they can find while on the run.
Out of desperation, yes.
Water lilies, grass, because there's nothing else.
There's nothing else.
This is an isolated community, but they do have help with the basics. Water from the Nile is pumped into special filtration tanks set up by World Vision. It's turned into safe drinking water. This is life-saving technology.
More than 2,500 people, individuals, are assisted through this water supply system. They depend on this.
It helps stop the spread of diseases. And as Andrew Cameron points out, there are plenty to contend with here. And what are most of the people here for?
Mainly malaria and other infections. Yeah.
He does it all in a fairly rudimentary facility. But Andrew says they cope.
So this is our nurses' station, not quite as flash as you might find in New Zealand.
Right, it's very basic.
Yeah,
so this is just a corrugated iron shed basically.
Yeah, it's pretty hot and at least it doesn't leak in the rain.
The hospital here in Kodok is always full. Because of that, they've had to set up numerous tents. Inside this tent alone, there's 30 patients. It's excruciatingly hot, but it's the only option doctors have.
Matthew.
Andrew's been awarded numerous international honours for his work helping the most vulnerable.
Have you got much pain?
But he's modest about his achievements, more concerned about helping those in need. And how do you personally cope with that, seeing that type of trauma on a daily basis?
You try not to think about it too much, you just have to get on and treat the people as most professional way you can and give them some dignity in their care.